So our project title is Breastfeeding versus Bottle Feeding. We'll be discussing pros and cons of breastfeeding, the pros and cons of bottle feeding, the techniques for bottle feeding, the techniques for breastfeeding, and the ethical dilemmas that come with both. Breastfeeding contributes to a child's well-being in many ways. Breast milk gives the infant total absolute nourishment because it contains an abundant variety of macronutrients and micronutrients that are essential for life. These nutrients include lactose, lipids, polyunsaturated fatty acids, and amino acids. Breast milk is easily digestible for the child due to the whey and casein protein content. The high fat content and number of amino acids support appropriate myelination of the infant's nervous system. These immunoprotective components include an abundance of antibodies, leukocytes, hormones, and antimicrobial peptides, cytokines, chemokines, and other bioactive factors that may be crucial to the infant's defense against common pathogens. The infant comes from a womb that is essentially a sterile environment that does not contain pathogens and advances into a world that is abundant with microorganisms after delivery. If the newborn is delivered vaginally, its gut and integument is colonized with microorganisms that is first in contact with, such as the maternal gut. The mother's breast milk helps provide the exact defenses needed to protect the infant from the pathogens that were in the maternal gut. Flora. The components of breast milk not only protects the infant from harmful microorganisms that could potentially make them sick, they also provide substantial anti-inflammatory benefits as well. The purpose of anti-inflammatory effects is to conserve the GI and respiratory systems to promote proper nourishment. Growth and development of the infant. Due to the fact that breast milk affects a child's growth and development in many ways, questions have come up regarding if breast milk correlates with fat deposition and obesity in childhood. Breastfeeding is also free, all natural, and establishes a bond between the infant and mother. There are also several disadvantages to breastfeeding as well. Vitamin D supplementation is recommended while breastfeeding. However, vitamin D is just a small expense when compared to buying formula. Another downside to breastfeeding is that not all mothers can do it. According to the CDC, mothers with HIV, active tuberculosis, and other illnesses should not breastfeed. In addition, mothers who are undergoing radiation therapies dependent on illicit drugs and taking chemotherapy medications are not advised to breastfeed as well.
Okay, so I'm going to talk about some different breastfeeding techniques and holds. First off, the mother's latch score helps determine what specific interventions need to be done to achieve effective breastfeeding. It determines if the breastfeeding session is effective by grading the infant's readiness, the ability to swallow the milk, type of nipple the mother has, comfort of the mother's nipple, and positioning of the mother and infant while breastfeeding. Each letter of latch represents a key component. L is for how well the infant latches on, A is for audible swallowing, T is for the mother's nipple type, C is for the comfort of the mother, and H is for the help mom needs in holding the infant to the breast. And a score of 0, 1, or 2 is signed on these 5 key components of breastfeeding and can alert the nurse to where the problem lies and what she needs to do to fix it. Breastfeeding is not an innate skill, and many new mothers have problems finding the most appropriate way to breastfeed. The infant should feed 8 to 12 times a day with 6 to 8 wet diapers and 3 to 4 bowel movements per day. The infant should regain their birth weight by 10 to 14 days, and breastfeeding should never be painful. There's 3 different holds or positions that can be used. First is the cradling position, second is the football hold, and C is the sideline position. Proper breastfeeding technique includes you need to teach the mother to wash her hands before she starts feeding. Be sure the infant is awake and alert and is showing hunger signs. Encourage the mother to relax so it'll help her let down reflex. Teach the mom to form a C shape with her hand to hold the breast. Have her tickle the infant's lip with the nipple to stimulate the child to open their mouth. Bring the open-mouthed infant to the breast. Show her how to check the infant's mouth position is correct and to listen for the sucking sound. And then you want to teach her correct removal from the breast using the finger to break the suction. And you want to instruct mom on how to burp the baby before changing the breast. And now we're going to show a short video that shows the proper holds and breastfeeding techniques.
Latching on is the term that describes how your baby attaches to your breast. Understanding and mastering the steps to latching on is the key to a successful, satisfying breastfeeding experience. In the next few minutes, you'll learn the steps to proper latching on. It's easy and a uniquely wonderful experience for you and your baby when you know how. First, get into a comfortable, slightly reclined position. You can use pillows for support. Elevate your feet to raise your lap slightly. Choose a position for your baby that works well for both of you. Here are 4 common ways to hold your baby during nursing. The cradle hold. Baby's head lies in the crook of your elbow or on your forearm. The cross cradle hold. Your arm goes around baby's back. You support baby's head with thumb and forefinger behind baby's ears. The clutch or football hold. Baby lies on his back between your side and your flexed arm. The side lying hold. You lie on your side facing baby. Experiment to find the position that works best for you and your baby. Whichever position you choose, your baby should be close to you with his mouth and nose facing your nipple and his hip, shoulder, and ear aligned. Support your breast by forming a C or a U with your thumb on one side and your fingers on the other. Be sure your fingers are far enough away from the areola that they don't get in the baby's way. Gently squeeze your breast, being certain that the squeeze is in line with your baby's mouth. When baby's mouth is wide open, bring baby to your breast. During a correct latch, baby will catch his lower lip on the breast and bring his upper lip over the top of the nipple, with his head tilted back. It's important baby latches on to as much breast tissue as possible, with his top and bottom lips flanged open like a fish. Most of what baby takes in comes from the part of the breast closest to his chin. In this technique, known as the asymmetric latch, the nipple is pointed toward the roof of baby's mouth.
Okay, I'm going to talk about the pros and the cons of bottle feeding. One of the pros of bottle feeding is it's more acceptable in public. Breastfeeding in public can be a controversial issue. Some people look at it as a sexual thing, and it's not. But it makes them feel uncomfortable and to see a mother feeding her baby in public. And so babies are fed on demand, and they're not always on a schedule. And if the mom feels uncomfortable feeding their baby in public, if they still want to breastfeed, they can pump into the bottle and use that in public. And then they're able to get out and carry on with their normal lives. The second pro that I want to talk about is the exact amount of milk that the baby would be getting. The mother, if they're going to bottle feed their baby, they have more of a concrete knowledge of how much the baby is getting. Sometimes breastfeeding can be difficult at the beginning, and you don't really know if the baby's getting enough to thrive and getting the nutrients that it needs. Bottles have markings that shows the ounces on the side, and it just takes one look to be able to tell how much the baby is getting. Another pro is the mom doesn't have to be present. If the mother has to go back to work quickly, then she wants to breastfeed, she can always pump into the bottle, and anyone can feed the baby. So the mother is free to go back to work and take care of household chores. If the baby is iron deficient, there are formulas that include this, and the baby doesn't have to have a separate supplement. The first con that I want to talk about is the cost of bottle feeding. It can be very substantial. You need bottles, you need nipples, bottled water, and the formula. Getting the formula right and the right temperature is important. Formulas can range from $54 to $198 a month. And when you combine that with having to buy diapers and clothes for the baby, you can spend a small fortune quickly. The second con would be supplies not being available. If you have to go somewhere and you have to take all the formula and bottled water and everything with you, if you get stuck in traffic or something and you're out of that, then you won't have time to be able to fix it. And so prep time can be substantial to be able to take all this with you. The third con would be the lack of bonding. Breastfeeding provides closeness between mother and baby and nurtures, which helps the baby to grow and be happy and healthy. And the baby feels safe and protected when they're breastfed. Bottle-fed babies are sometimes propped up and fed by themselves, and they don't feel the closeness as with breastfeeding. So the mother should choose that time. If she is breastfeeding, then she can hold the baby close and nurture. So in closing, breastfeeding is not for everyone, and don't feel guilty if you can't breastfeed. Plan for what is convenient for your situation.
Hey y'all, I'm going to talk about some ways of bottle feeding, some techniques, and talk to you a little bit about that. So the number one thing we want to do is wash our hands and have clean equipment. It's important that we do that because our babies are immunosuppressed and we don't want them to catch anything that's unnecessary. A lot of people think that when you bottle feed you can't bond with your baby, but that's not true. You can bond with your baby when you bottle feed, just as you would with breastfeeding. You hold the baby close to you. You can do skin to skin while you're bottle feeding. So that's a myth. You can bond just as much with bottle feeding. You want to remember to never microwave the bottle or the water in the bottle, because we could get the temperatures too high and we don't want to burn the baby's mouth or throat or anything like that. It's important that we do not prop the bottle because this could cause problems with swallowing and it could lead to aspiration precautions, and it doesn't promote good nutrition for our baby. It could cause extra air in their bellies and lots of spit up and all that. We need to remember after every couple of ounces that we're going to burp our baby, and we're just going to sit the baby up and pat their back until they burp, and then continue bottle feeding the way we would before. And so with that being said, you can, bond with your baby while you're bottle feeding.
Now we're going to talk about ethical dilemmas, and we're going to focus on HIV positive women. In the U.S., the CDC has a recommended treatment for HIV positive women, which includes antiretrovirals for the mom and baby 6 weeks after birth, and exclusive bottle feeding. And this reduces the rate of transmission from 25% to 1 to 2%. And now we shift focus to a developing country like South Africa, where their resources are limited, clean water is limited, especially in the rural areas. So formula becomes an issue, and also it's at the epicenter of the HIV epidemic. And in South Africa, they highly value breastfeeding. It's a cultural practice. They do it in front of their in-laws, and women are expected to do to breastfeed, to provide that nurture between the mom and the baby. And in this one scenario, this woman who was HIV positive, she gave birth to her baby. She received one dose of antiretroviral. The baby did as well right before discharge. And the midwife, South African nurse midwife, was telling her about this HIV clinic that she could attend, and she would get formula for the baby if she attended the clinic. But the woman refused because if she attended the clinic and if she got the formula, then then she believes that she'll be identified by her family and community as being HIV positive. So she just opted to breastfeed the baby, and the nurse midwife just told her good luck. So as future nurses and looking to other countries where they have their own set of protocols for how they handle HIV positive women and breastfeeding laws and everything. We as future nurses always have a standard of wanting to do well, not doing harm to anyone. So when we have a conversation about this with other people, we have to be open to their cultural practices, because if we immediately say that no, they can't breastfeed, then we just shut down all communication, and they might not be willing to work together to find a solution to eradicate the HIV epidemic in the world. So we have to be open, and we have to be willing to discuss these issues.
Oh my God, honey, what are you doing? You know
I'm
you're
feeding
not.
the baby and I'm watching the
No,
game.
you remember what the nurse said. I've been cooking and cleaning in the kitchen, and all you can do is prop our baby up. You feed our baby the right
You
way.
asked me to feed the baby. She's getting fed. What do you want?
She can aspirate. You remember
I
how
don't
to feed
even
the
know
baby?
what that means.
Yes, hold our baby. Don't prop the bottle. You want Thanksgiving dinner? You're gonna do it the right way. We're done now, right?
Good evening, Mrs. Bowe.
Hey.
Are you breastfeeding?
Yes, this is called the high flying monkey hold. My ancestors have used this hold for years.
Well, I think there's a better hold that we can use that is more comfortable for you, okay? You want to stay covered up? Okay, look at your arm right here. Okay. Is that better? You have a great day.